Hi guys, it's Dr. Williams with Peacock Pediatrics. Today I want to talk to you about your 15-month-old. Your baby has become a toddler seemingly overnight. They are babbling all day, saying a few words. They can scribble with a crayon or drink from a cup. They are climbing and running. They can follow one-step commands. And what do you do now? So at this age, your baby is exploring constantly, trying to figure out how things work. Their biggest mission in life is to figure out how to get your attention. So your job as mom or dad or the caregiver of the child is to teach them how to get your attention. The way that you do this is by paying attention to the behaviors that you like, completely ignoring or redirecting the behaviors that you don't like without words or eye contact. So if your 1-year-old or 15-month-old is playing with a remote control, instead of saying, no, don't touch that, you are going to physically take it out of their hands and put it up without looking at the behavior or talking to the behavior. If they're pulling the dog's fur, so you're going to go pick up the baby, remove them from the situation, put them in a place where their toys are or there are things that they can play with safely, but without talking to them or looking at them during that time. If they're throwing a fit on the floor, screaming, crying, as toddlers do, you're going to completely ignore that. So you can't hear or see it. You have to pretend and you have to practice that you cannot see or hear the toddler throwing a fit on the floor. And then as soon as there's a break in the crying or the yelling, that's when you go to them or you console them or you ask them, are you upset about something? Did you need help? Make sure you're using lots of positive language and reinforcement to try to teach them how to get your attention. So when they're playing nicely with their blocks or they're reading books nicely, pat them on the head. You say, you're such a good boy. You're doing such a great job playing with your toys and those kinds of things. And that really, really will make a difference in how your toddler attempts to get your behavior, to get your attention for the rest of their toddler years. So it's a really important time to start in on that kind of parenting. Your 1-year-old is also trying to constantly control their environment. So anything that they can have control over them, it's a good idea to give it to them. So offer them options that are equally acceptable to you. So, do you want to use the yellow cup or the blue cup with dinner? Those are fine options, but don't offer options that are not optional. Do you want to brush your teeth? That's not an option. We have to brush your teeth. But do you want to brush your teeth first or put your pajamas on first? Those could be viable options. Make sure in that regard to make oral health a priority from the start. So brushing their teeth twice a day with a small smear of toothpaste is very important. Making sure that you're not giving them milk or juice after they've brushed their teeth. So only water at bedtime or in the night if they have a cup in their bed. Switching from bottles to cups and getting rid of pacifiers can all be really good for your baby's oral health. Offer meals and snacks every 2 to 3 hours. So sit down in the high chair at the table with a meal or a snack, and put calories away in between meals and snacks. So they can have water, but they don't need, snacks available all day long. Offer 2 to 3 servings of dairy a day at meal or snack time, and avoid all sugary beverages or juices. They just don't need them. Make sure to keep your toddler in a rear-facing car seat for as long as possible, but at least until age 2. So that convertible car seat can typically accommodate children up to age 4 or so in a rear-facing position, and they're safest that way. So don't be in a hurry to turn them forward-facing. Make sure they're strapped in all the time, every time, with the chest clip at the nipple level to maintain the safest possible in the car seat. And make sure you're reading and singing with your baby every day. It's really good for language development for them to hear words and speaking just constantly. work on keeping a consistent bedtime routine every day, no matter what, at the same time with your bath and brushing your teeth and your pajamas, and then getting into bed. That can really help with good sleep hygiene. If you have specific questions about your 15-month-old, you can always find more information through the AAP at healthychildren.org or Bright Futures. And of course, we're always glad to talk to you about your 15-month-old at Peacock Pediatrics. You can give us a call at 816-396-6026 to schedule an appointment if you have further questions or concerns. Thanks so much. Bye.